Greetings and welcome to your destination. You've reached the Psychological Wellness Hub. We aim to help you build your knowledge and wellness around better understanding of mental health and psychological concepts. Welcome back to the channel. Today's topic is geared towards answering this question. What is cognitive therapy? Remember to stick around till the end of the video to get more answers and where to go next and the next steps. Psychotherapy treatment, a quick review. It's a form of talk treatment that focuses primarily on mental health, substance use disorders, or other medical conditions, and many more. It's a journey of self-discovery and healing. Therapy involves you and your therapist working as a team. As a team works together to make connections with your problems so you can relate to those internal forces that keep those problems going. The team works together to look inside you as well as outside of you with the intention to understand the inner and outer workings of how the problem lives and breathes. You are the navigator and the therapist is a guide to help you understand and make use of your thoughts, feelings, and actions. This is an effort to identify and, if necessary, make changes for the positive and to promote healing. What is cognitive therapy? It's a form of psychotherapy treatment, also called CT, that focuses primarily on mental health, substance use disorders, and other medical conditions, and many more. What is a basic understanding of cognitive therapy, or CT? As stated above, look at the name of this treatment. It clues you in a little bit about it. As humans, we are always thinking and behaving even when we're not fully aware of it, both consciously and unconsciously. As humans, if we think something and feel something about a stimulus, the stimulus can be a person, place, thing, situation, environmental issue. If we go back to that, if someone's thinking or feeling something about a stimulus, we can behave in accordance to that thinking or feeling about that stimulus. The stimulus can also be us, ourselves. So if I look in the mirror and have thoughts representing someone who is capable and emotions come from that thought that support it, then I will likely continue to engage in thoughts, feelings, and actions that support this. However, if the same person looks in the mirror, has thoughts about someone who is broken and incompetent, that person will also have accompanying emotions in support of that. Actions may also follow this thinking pattern or narrative. Cognitive therapy, or CT, is a treatment model that subscribes to what we were just talking about. It works to help an individual with this, discovering this pattern and ways to be able to work through it. Cognitive therapy is a standalone treatment, but its successor is known as CBT, or cognitive behavioral therapy, which will be seen in another video. How does cognitive therapy treatment work? There are many different ways to understand this. There are many different approaches or forms of cognitive therapy. You and your therapist will work together to form an agreed upon approach that may include cognitive therapy. You and your therapist will check in at certain intervals, usually often in the beginning and more spread out over time. Each meeting as part of the check-in will be opportunities to work together to review previously covered material or practice assignments, sometimes called homework. You will review new material. This generally involves talking about, visualizing on a board, or using a worksheet to examine your thoughts, feelings, and sometimes actions to not only determine how they play out, but how they affect you and what you want to do about them, if anything. Sometimes at the end of a session, your therapist will check in and summarize what you've covered that session and what to do between sessions and make changes as clinically necessary. Therapists may check in over the course of treatment to evaluate and adjust or make sure that you're moving towards your therapeutic goals, what you might refer to as your treatment goals. These might be ways of describing, reducing something that is bothering you and ways to feel better. Cognitive therapy can be done in a variety of settings. It can be done in behavioral health clinics on an outpatient basis. It can be done inpatient, in partial hospitalization settings, residential treatment facilities, IOPs, or intensive outpatient. It can be done in a person's home, in jails, nursing homes, sports medicine clinics, professional sports teams locations. It can be done in person, over the phone, or by video. Cognitive therapy can be done alongside other forms of treatments and supports like psychiatry, mental health medication prescribers, group therapy, case management, recreational therapy, and more. Please see a separate video which will explain more on these terms and what we mean by these and expand on them further. Why does one want to or need cognitive therapy? One has decided to be proactive in their lives. That is, they want to improve themselves or their situation before it becomes a problem, or after it's become a problem already. If it has already become a problem, then one is seeking treatment to resolve the problem. Some go when they need help adjusting to new life situations, things like a divorce or breakup, maybe getting married, relocating, or just have moved, job stress, marital resilience, maybe a new role they're in. Could be lots of things. What difficulties or problems can cognitive therapy treatment be used for? Cognitive therapy treatment can be used to address many difficulties. We only address a number here. These include, but are not limited to, things like depression, anxiety, tinnitus, pornography addiction, gambling, bipolar disorder, schizophrenia, marital difficulties, communication problems, panic, social phobia, writer's block, existential difficulties, and many more. What does cognitive therapy look like? I'm going to read an example of some portions of an individual's treatment session with cognitive therapy. Please note these are not real people, but their stories represent real scenarios. Listen to why I tell you about their stories. Listen for details of the treatment. Listen to how the individual engages in the treatment to work towards their goals. Remember, this is just a snapshot of this kind of therapy, what this kind of therapy could look like. There are many things happening that are not mentioned or elaborated on in this example. It is not all complete in the description below. Marcy is a woman in her 40s who struggles with depression. Marcy comes to psychotherapy treatment to help deal with this condition. She meets with her psychotherapist for the first time. She and her psychotherapist do an assessment in her initial first visit to establish a diagnosis or a working diagnosis that relates to her concerns. If time allows, in the first or perhaps the second session, Marcy and her therapist will develop a brief treatment plan. Marcy chooses a thinking and behaving method, or what's referred to as cognitive therapy or CT approach, to help her in therapy. This approach allowed her and her therapist to look at information that was not in Marcy's awareness, that there was a relationship between her thoughts, behaviors, and emotions. So if Marcy thought and felt something about herself, others, or a situation, she would behave in a way that was consistent with that thought or feeling. Marcy and her therapist began by discussing and understanding more about her experiences as well as her thinking, emotions, and sometimes her actions around anxiety. As Marcy starts to face and learn from her behavior, she begins to learn more about it and labels it when she sees it. She does this with her therapist in her session on worksheets they work on and look at together, as well as in some practice assignments at home. Marcy, through the help of her therapist, becomes more aware of some of the thoughts and feelings around this. She would have common thoughts like, I always feel under pressure. Something bad is going to happen. I just know it. People only like me when I give them something. I'm always messing up at things I try to do. As Marcy looked deeper into these thoughts, in her core, she realized she had some thoughts like this. I'm not capable. Emotions will hurt me. Marcy also was able to identify emotions tied to this thought, like anxiety, guilt, sadness, and anger. As she continued with more sessions, Marcy started to explore her behaviors in general and how she has started to reduce her own activities as she became more anxious. She was ambivalent for a while in therapy, and in later sessions, after working through some of the thoughts, she started to shift these actions in this area, taking invites from her girlfriends to go do things, getting out more. Marcy also learned about some of the other types of thoughts or cognitions. She wrote down these thoughts to share with her therapist that said, I must feel guilty when I feel anger towards someone else I'm helping. Only a bad person would feel anger that way. Marcy wondered if this had something to do with the way she grew up. Marcy had now discussed through several therapeutic transactions what contributed to her anxiety and depression. She became aware of more core beliefs like, I'm no good. People will not like me if I don't help them. My goodwill is the only thing I have to offer others. Marcy also became aware more of her thoughts through restructuring these thoughts. For example, the thought, my goodwill is the only thing I have to offer, became, I have many skills that I value about myself and others like it too. Things like my ability to get through hard times, my sewing skills, my passion for reading. While I do appreciate others appreciating my goodwill, this is just a small part of me. My goodwill is a skill too, but it's mine to give out, and it doesn't belong to others to decide if I give it or not. As Marcy continued on with her therapy, anxiety became more manageable. She was more in charge as she continued through the stages of recovery. Marcy continued to feel better, less weighed down with pressure, more relaxed, more at ease with herself. She continued to help others, but in moderation. She was able to keep a keener eye for not beating herself up and to see the red flags for her and others' behaviors that didn't serve her or her best interest. Marcy's self-esteem continued to grow, and she had more fulfilling and meaningful relationships with herself and with others. We hope you found today's topic was useful for yourself or someone else. Let us know if it was by commenting below. Let us know what you'd like to hear about or what topics could be useful to you by commenting below, and we'll take it under consideration. If you like what you heard today and like to hear more from Destination Psychological Wellness Hub, please consider liking and subscribing to the channel or the page. This will help you get the newest content produced by the channel or the page to you. Please tell all your friends and family about this channel. Share this and other videos with them on this channel. Encourage them too to like and subscribe. And as always, we hope your psychological wellness continues to grow with us in this community. Thank you.